Hi everyone, I'm Dr. AziMD Skincare, a board-certified dermatologist specializing in medical, surgical, and cosmetic dermatology. I'm also the founder of AziMD Skincare. Today, I want to talk about hormonal acne. I mean, we all know acne is so frustrating. And if you are a female in your adult years and still breaking out, that is even more frustrating because you may have been battling acne your whole life, but female hormonal acne can have a significant impact on our confidence, our life. It can definitely be a stressful condition to deal with, especially since you see it every single day in the mirror, you look at it, and I can sympathize with you because after having 2 children, I started suffering from hormonal acne, like severe. I was getting these big cysts, they were in my ears, on my face, and I was like, okay, I'm a dermatologist. I cannot be getting these big, painful bumps and lumps. And so I understand how frustrating it is. I get a lot of questions about hormonal acne. So I wanted to make an entire video dedicated to this topic in the hopes that it will help you understand and manage this treatment. There are ways to eliminate it and you can live your life acne-free as an adult, I promise. But before we get started, don't forget to rate, review, and subscribe, and share this with a friend who might find this information valuable. So what is hormonal acne? Well, it's different than the teenage acne that you see as a teenager as you're going through puberty. You know, your hormones are changing and you get, increased oil glands, and that type of acne can be all over the face, and it can be mild or moderate or severe. Adult female hormonal acne generally happens along the jawline, and it's these deep cystic acne pimples that you get. They're not just on the surface, they tend to be really deep. Now they can also fluctuate with your menstrual cycle. Now there's really 2 categories or 2 reasons for this. So why does this happen? Why do we get hormonal acne as an adult? Well, one, it could be that your hormones are abnormal, particularly hormones like prolactin, testosterone, DHEA. So these hormones, when they're abnormally high, can cause the oil glands to secrete more oil, can interfere with how your skin is going through the different skin layers and maturing, so it can be more prone to clogging. And so in those cases, we really need to treat the underlying cause, which is the hormones are the problem. But actually, in the majority of adult female hormonal acne, it's not the hormones that's the problem. The hormones are fine. We check the hormones, there's nothing wrong with them. It's the way your skin responds to the fluctuations in the hormones in our cycle. Because, during the early phases of your cycle, we see the estrogen go up, and then we see it go down, and then the progesterone shoots up, and so forth. And so these fluctuations in the hormones can cause some disruption in the skin. Estrogen helps boost collagen, it helps the skin layers mature more effectively. Your skin generally doesn't clog when you have dominance of estrogen. But when the progesterone takes over, then you might notice more oil secretion from your oil glands. And so sometimes the fluctuations of your cycle can cause the skin cells to halt and cause more oil production. And that, in some people, can really break havoc and lead to breakouts. And some of that could just be, the sensitivity, the nature of your skin, and that changes throughout life. For example, I never really had adult female hormonal acne in my 20s. It's something that I developed later in my 30s. It's really your hormonal climate, your skin sensitivity to these fluctuations. Now, it's really important to keep a regular, consistent skincare regimen that supports your skin barrier, because that's really important for acne. It helps prevent the buildup of skin cells. It helps optimize your skin to really be able to handle some of these hormonal fluctuations. So what can you do from a topical standpoint? You can use products like salicylic acid, like Differin or retinoids. You can use azelaic acid if you have real sensitive skin, and just have a very consistent regimen. Cleanse, treat with some of these active ingredients, and then don't forget to moisturize. A lot of people think, well, I have acne, I better not moisturize or put any cream on. wrong. One of the main causes is a compromised skin barrier, and moisturizers are actually really important to support and strengthen that skin barrier to help with healing the acne. To make things easy, you can find skincare regimens for different types of skin that have acne on our website. Whether you have oily, sensitive skin or you have normal skin, there are different acne regimens that you can check out on AziMD Skincare just to make things more simple. But sometimes, despite using all these great active ingredients that help with, hormonal acne, you still get these deep under the surface cystic pimple nodules, and there's really no topical that is going to be able to treat that. At this point, you really need oral medications to help with that deep cystic acne. So how do you treat adult female hormonal acne? First, I want to say it's really important to have an evaluation by your dermatologist or your doctor to really make sure that you have ruled out all these other potential causes like PCOS or abnormal hormones. But in general, oral medications like antibiotics such as doxycycline, minocycline, and then there's a new one called Cicera, which is even more specific for acne with much fewer side effects. These are oral agents that help calm inflammation, help reduce the acne bacteria that end up, really treating the cystic acne rather quickly. And then there are birth control pills that help stabilize the hormones. So your hormones are not going up and down like this, so therefore your skin is not, going haywire and forming these deep cystic pimples, because it's really a response to all these hormonal fluctuations that people get hormonal acne. So when you stabilize the hormones with birth control pills, the acne gets better. But it takes about 3 months for you to see improvement with birth control pills. Now, there are some birth control pills that can make hormonal acne worse, and that's because those birth control pills have a progesterone in them that look a lot like the male androgenic hormones that cause acne. So you have to pick the right birth control pills, and this is something you should talk to your doctor about. But in general, birth control pills like Yaz or Yasmin or orthotricycline low tend to be better for acne. So sometimes birth control pills or IUDs that secrete only progesterone like Mirena, those can actually cause adult female hormonal acne, and people don't realize that. Some people's skin are really sensitive to these hormones that look a lot like the male androgenetic hormones. Birth control pills can be helpful, but they can also cause acne. Another oral treatment, which is one of my favorites, is spironolactone. Now, spironolactone is not a hormone. It's actually a diuretic, a water pill. So if you tend to hold on to a lot of water, you feel bloated, you're puffy, it tends to get rid of that excess fluid buildup. Spironolactone is also used by cardiologists to help remodel heart tissue. People that are in heart failure, it has been shown to help remodel the heart, and it's also used as a potassium sparing diuretic for people that are on diuretics that get rid of their potassium. So it wasn't initially a dermatologist go-to for female adult hormonal acne, but it works great in that it really helps control the oil secretion. It makes the pores look smaller, it makes the skin just look beautiful. And it's one of my favorite treatments for adult female hormonal acne. You have to be on it for at least 3 months to really see a difference, but sometimes it can take up to 6 months, so be aware of that. I personally was on it for 5 years. I've now stopped it because my hormonal acne has thankfully phased out of my life. So it could be something that you're on for a year, maybe a few years, and sometimes no matter what you do, you kind of have to stay on it. And some studies recently have shown it to be relatively safe. I think it's safer than being on antibiotics for years and years and years. So I personally really like it. Potential side effects, which some people may really like, it can cause breast enlargement. So we don't like to give this to men because of that risk of side effect. It also can help promote scalp hair, reduce facial hair, all the things that male hormones tend to do, the spironolactone tends to block and cause the opposite effect. It's not something you can take if you're pregnant because it can have adverse effects on a baby, and it's not something you can take when you're breastfeeding, but it is an option for somebody who is not wanting to have kids. So make sure that you talk to your doctor about going on this medication if you're thinking of trying to get pregnant. A relatively new prescription called Winlevi is also an androgen fighting topical prescription. So it's not an oral, but it's a topical treatment that again helps fight the male dominant hormones that are causing the increased oil secretion and causing that hormonal acne. You want to use it twice a day, and you start to see results anywhere from 4 to 6 weeks. And then when all else fails, you've tried the antibiotics, you've tried the spironolactone, and you've tried the best topical regimen in the world, then there is Accutane. Accutane is a wonderful medication. Accutane is a vitamin A derivative oral medication, also known as isotretinoin, and it is the oral form of Retin-A. I love Accutane. I have hundreds of patients on Accutane every month, but it is very difficult to prescribe because despite all these regulations, we're still getting 150 pregnancies a year, and those pregnancies end up with deformed babies. And for that reason, the FDA has made it very difficult to prescribe. So you have to be seen regularly in the office, you have to do blood work, but it's a miracle drug, meaning I have not really had very many patients that didn't clear their skin with Accutane. So it is a for sure thing. It will clear your skin. Now there are potential side effects, just like any other medication, but in general, the most common side effects I see are dry lips, dry skin, dry eyes, dry nose. You might get some nosebleeds. Now if you're an athlete, you're doing a lot of training, you might notice your joints, your muscles being sore, particularly at a higher dose. But sometimes we can just use really low doses over a course of 6 months to a year, and that works phenomenal, and you don't really experience a lot of these potential side effects. We do blood work, and that's one of the reasons I find Accutane to be safe, because we really monitor your body really closely, and it's generally a 5 to 6 month course. But again, there are variations. And then let's talk about hormonal acne and nutrition and lifestyle, because this is important, and a lot of dermatologists may kind of brush this off or may not really talk to you about it during your visit, but nutrition plays a big role in female adult hormonal acne. And according to studies, the 3 things that have shown up in these studies over and over again are sugar, dairy, particularly cow's milk, and then processed foods. So you want to really limit your sugar intake, because the spikes in the insulin can affect your skin cells and oil glands, and you want to limit the amount of dairy you're consuming, particularly skim milk from cows, more so than any other type of dairy. And then processed foods like bacon, hot dogs, these are processed meats. So really you want to lead a very healthy diet. Make sure you're drinking enough fluids, you're taking in your vitamins. If your diet is kind of poor, you can take vitamins. These skin to mint vitamins make it really easy to take, and you get your vitamins that you may not be getting because your diet isn't great. But ideally you want to eat fresh fruits and vegetables and really get your antioxidants in, make sure you're hydrating. Those are really important things. And prebiotics, if you're not having a well-balanced diet, that also plays a role in your gut and your skin. We really need the good yeast on our skin's microclimate to be able to keep the bad bacteria in check. So prebiotics, whether it's you're having some yogurt, that's really important. And then there is stress. Stress can significantly make your hormonal acne worse. It plays a major role, whether you're not sleeping, you're stressed, that causes your cortisol level to go up, and that can really wreak havoc on your skin. So whether it's you're exercising or you're meditating, whatever it might be, make sure that you really take care of yourself, because a healthy mind is a healthy body. Whatever makes you happy, make sure you carve out some time every single day of your life to combat those factors that play a huge role, not just on our skin, but on all the organs. The skin just happens to be the biggest organ that we have. Moving on to what can we do for adult female hormonal acne in the office, what procedures are helpful. A new technology I'm so excited about is a procedure called AviClear. It is the first FDA approved laser, not FDA cleared, but FDA approved, which means clinical trials have shown it to be beneficial at treating acne. And this is a laser that's a 1726 nanometer laser that targets the oil glands. In clinical trials, it's been shown to be as effective as Accutane, so I'm super excited to offer it in my office. I can't wait to show you more on my channel about this, because some people don't want to take oral medications. They don't want to go on Accutane. All these things are systemic treatments that have potential side effects. And so AviClear is such a great option. It's 3 sessions. You want to do it every 4 to 8 weeks. And what I love about it is it doesn't do anything to the surface of the skin. So it works beneath the surface of the skin because it targets the oil glands. We can treat all skin types, dark skin, light skin, and you don't have to worry about, being out in the sun. It doesn't make you sun sensitive. And there's really no downtime because it doesn't affect the surface of the skin. It penetrates and goes deep. In clinical trials, 80% of patients saw their acne clear over the 3 sessions. The cost can be up to $5,000. It ranges anywhere from $3,500 to $5,000. For more information, contact my office because we do have this device. We're one of the first practices in the San Diego area to have it. So I'm really excited to treat patients with it. Other treatments are things like chemical peels. I love Jesner's peels, or if you're light skin, TCA peels. If you're darker skin, the Perfect Peel. This helps not only with the acne, but it can also help with the staining and the pigmentation that's left behind. In general, you put the peel on. After a few days, the skin starts to shed. You will look like a lizard for a couple of weeks, where that old skin starts to come off. Really, the final result isn't seen until about 3 weeks. So it is sort of a longer process, but chemical peels work great for acne, but you really still need medical therapy for hormonal acne. And then I encourage my acne patients to get facials periodically. That helps with extractions. Diamond Glow is really popular in my office, which is almost like a deep cleansing facial. I also love the ice facial. It helps reduce inflammation. It's just very soothing and very comforting. And then lastly, Forever Clear BBL. It uses a blue light to target the acne bacteria, and then the red light to target the redness and inflammation and staining that happens with acne. Ideally, you want to do 4 to 6 sessions of the Forever Clear BBL. These office procedures are generally needed with medical therapy, except for the AviClear. When you're on AviClear, a lot of times, that could be your sole treatment. All right, guys, I hope that you found this helpful. Don't forget to rate, review, and subscribe, and comment below. Let me know if you have any questions. And check me out on Instagram at Skin by Dr. Ozzy, and my podcast, More Than a Pretty Face. Until next time.